Hey crew, welcome to the MMOA podcast. My name is Dr. Shelby Blankenship. I am one of your TAs in the older adult division and also a physical therapist. Today we're going to be talking about how you can transition between a therapist, whether that's occupational or physical, and then transitioning to a personal trainer. Whether that's with the same patient or whether you're in the same clinic to do both, that's totally up to you. But we're just going to give you some ideas to kind of help you distinguish between the two so that you don't feel that you're getting caught in the whirlwind of trying to be two people at once. So when it comes to physical therapy or occupational therapy, most of the time, one of the easiest ways to really kind of decipher between us and a personal trainer is we are really into a test-retest model, but it's very specific to that person. So it's going to be related to whether they're having pain or a physical or functionality limitation to doing activities of daily living, being able to walk in and out of their home, independence in the community, et cetera, et cetera. And so it usually has very specific goals to what we're wanting to do. And it allows us to kind of retest every session to kind of see where they're making progress. Now, we kind of have that similar model with a personal trainer, but it's a little bit different in that we are really trying to get after increasing their capacity to lift heavy, increasing their speed to do something, and sometimes maybe it's increasing depth or precision of doing a certain movement. We're trying to really track squat load, back squat, front squat throughout personal training to see how they're progressing. We might do like a 5x3 or 5x5, try to really do some strength gains and then combine it with other modalities. Whereas with physical therapy or occupational therapy, we're really trying to not only maximize their capacity of those functional loads or those kinds of things, we also are trying to really make sure like pain is in a good spot or we're modulating pain appropriately. And then also making sure that their goals are being met as far as like why they're even coming to therapy in the first place. Now, the next kind of tier that we're going to be looking at is thinking about like the overall structure of your session. Now, at our clinic, we try to do 1 hour sessions regardless if it's personal training or physical therapy. And so I'm going to kind of give you that structure based on an hour, and then you can condense or extrapolate as needed. So for physical therapy, or if you have an occupational therapist, we're really going to be looking about building the bike, as we always talk about in our spine courses, trying to get buy-in to what we're doing, but also showing people how they are progressing. So we're going to be touching those asterisk points, really trying to see where they're progressing, where their limitations are, and then what homework they are already doing and how we can progress from there. A lot of it's going to be maybe using some manual techniques. Maybe it's going to be really dialing in on maybe like 1 or 2 goals that we're going to be dialing in that for that session. Most of the time for goals, when I have folks, I usually make anywhere from 5 to 6, and I'll pick 2 or 3 for that session. So there's usually like a deadlift with a farmer's carry goal. There's usually a step up goal. There's usually a sit to stand, whether that is speed and or with load. There's usually, if we're working on like upper extremity stuff there, I might have like a plate stacking or a shoulder, a push press kind of thing. And almost all of them have a floor recovery goal. So whether that is using a bench or not, we're trying to get everybody on and off the ground and see how many burpees. It might look a lot different for different people. They can do in a minute. That can kind of give me a good idea of like if they were to end up on the ground, how quickly they can transverse from that supine or prone position back up to standing or at least a seated position. Now, as far as how the structure of my PT sessions would go, it's going to be probably like we're going to have some conversations about what their progress has been at home, how their diet's looking, how they feel like their progress is going, what their pain level is at today, if that's appropriate. And then we're going to dive into a little bit of a warm up, whether that is like HIIT style using like row, ski, echo bike, or maybe like a sled push or pull, maybe even doing some like treadmill or outside gait things. And then we'll kind of transition into doing 2 or 3 items and kind of doing like a little bit of a warm up for those and dialing in those. And then we might add in some like what I call like successories or accessory work, where it's really trying to tease out certain items that they're struggling with. So if they really are struggling with like circumduction with gait, we might dive in a little bit deeper into lateral hip strengthening. Maybe we'll do some side plank work. Maybe we'll kind of combine a lot of the goals that we're doing and make it into a circuit EMOM style or AMRAP to kind of work on that conditioning piece. Now, when it comes to the personal training side, we're also going to be doing, a structured format, but usually it's a little bit more specific of, hey, this is a warm up. Hey, this is like our focus, strength, maybe skill work if we're doing like pull-up work, or we're doing back squats, or maybe we're supersetting with back squat and push press, et cetera, et cetera. And then we'll go into like a metabolic conditioning. Usually it's anywhere from 10 to 15 minutes for each of these sections, and then finish with recovery. Sometimes the recovery can be a combination of really kind of working on strategy of nutrition, sleep, those kinds of things, and kind of going through that. And sometimes it also can be like, hey, like every now and then I struggle with like my hip mobility, or we did a lot of deadlifts and I want to work on some like banded cat cows, just to kind of help reduce the recovery process that's needed after our sessions. Any coach can make a hard workout. A really good coach can allow you to progress and actually see those progressions without feeling like crap every single time you work out, because nobody wants to come to that. That just sucks. Now, those are some things that are different between the personal training side and the physical therapy or occupational therapy side. Now, let's go into some similarities that you're going to see between the two, at least from how I do this. So the biggest thing that I think personal trainers sometimes do better than a lot of our therapists is really managing the whole picture. So the meds is, I think, the best way to do that. M is for mindfulness, E is for exercise, D is diet, S is sleep. Extremity Division does a great kind of rendition of all about this if you want to dive deeper into it. And what I love about it is if your stress is just like out the wazoo all the time, you are going to struggle with pain. You are going to struggle with getting your exercise in. You're going to have a lot more struggles when it comes to this holistic approach. And I think it's one that we just often put to the side, especially with older adults. And we really need to dive deeper a little bit. And it's always a question I ask on my intake forms. It's like, hey, if you have a really stressful event, whether it's with your spouse, whether it's with your kids, grandkids, whatever it might be, how do you handle it? Do you, what makes you feel better? Do you eat a bunch of Oreos? Do you watch The Office? Do you, whatever it might be, just to kind of see what their baseline is. And then we can start sprinkling new strategies. My personal opinion, I wish everybody went to therapy. I think it would be great for the world. However, not everybody's willing to do that. And especially some of the older generations, they kind of have it's a hard line to cross for them sometimes. And so we need to be very honest, but also tactful with how we approach this, of not being like, hey, I think it's all in your head, but you also need to be like, hey, you're going through a lot. You're having to take care of your spouse who has Parkinson's. You've got all these things going on. What opportunities do you have for support? And I think sometimes they try to rely so much on themselves. And so, just kind of sprinkling in opportunities for support groups, being involved in community. That is huge, because sometimes you need somebody to just kind of be like, hey, I care and I'm checking in on you. And you might just start there. And it's the same with physical therapy. There's so many folks who come in with aches and pains that somehow simultaneously coincide with a death in the family or a really stressful event. It's not a coincidence. It happens a lot. And we need to be mindful and make sure we're diving into that a little bit if we have the opportunity. As far as E, that's exercise, we're kind of already doing that in our session. So make sure you're allowing some opportunity for things to do outside. It's not just what they do in that 1 hour. It's all the other hours matter as well. So, using a step tracker, seeing what their average is, seeing if we can increase it by 500 to 1,000 steps, and just kind of going from there. And then that also bleeds into nutrition. And when it comes to nutrition, it ends up being way, way less than they realize. And when I say way, way less, I mean nutritionally. Sometimes they're getting a lot of stuff in, but the nutrition factor sucks. And so what areas we can do to improve that and help them dial that in a little bit, and start with just one meal. Don't make it this huge overarching thing where they're like, I cannot achieve this. This is way, way too much. Nobody is able to handle that much input and try to make all these changes in one day. So pick one meal and be like, hey, I noticed at your breakfast, you don't get really any protein. So why don't we see what opportunities we can do to add? What things do you like? Do you like eggs? Do you like protein shakes? Do you like Fairlife? Do you like, all these other things? and try to see how we can maximize there. And then it will start sprinkling into other meals. I will have people track, or I will have people at least take pictures and show it to me to kind of see what they're doing. Sometimes it's an accountability issue. Sometimes it's a lack of knowledge issue, and sometimes it's I'm so exhausted, this is one more thing that I don't want to do. And that's where having a resource of meal plans or meal prep groups can be super, super helpful. It's amazing how so many people are so exhausted by the end of the day that taking one thing off their plate, especially when it comes to making meals, can be super, super helpful. And then, of course, the last one we got is sleep. And the amount of issues with sleep is pretty astronomical as people get older. And it's just one area we always need to touch on. If somebody's sleep sucks the night before you go to see them, that's probably not the day that you want to go after a 1 rep max. You want to be mindful of kind of where they're holistically going, whether that's for physical therapy things or for personal training things. You want to be mindful of those to make sure you're not overdoing it and make sure their recovery is in a good spot. Our older adults, it just takes longer for them to recover. And you hear all the time, oh, I'm getting so old. You just wait till you're my age and blah, 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 blah. And what I usually tell people is hey, when you're 10, your buoy for what your body can tolerate and what you can do with it is here. It is way out there. You can eat Oreos all day, sleep 2 hours, and go run a 5K, and it's not a problem. And unfortunately, as we get older, the buoys just get smaller. It's not that it's necessarily better or bad for you, or you just can't tolerate it anymore. It's that the buoys get smaller. And so when you treat yourself like crap, the amount of range that your body can tolerate to keep it going in the engine that you want it to be doing is lower. So you have to treat your body well. If I wished I would have treated my body much better when I was in high school. I wish I had known how much more of an athlete I could have been with protein. And so you have to find the thing that they will get after and stay consistent with. And that is huge. That consistency can really change somebody's trajectory on their life and help them become more masterful in being an adult and not just necessarily just riding the waves and taking a lot of hits as it comes. The last thing that is similar between personal training and the physical therapy side or occupational therapy side is you've got to monitor vitals with these people. It does not matter whether it is a physical therapy session that Medicare is paying for or not. You need to monitor vitals because that is essential to knowing how your patient is doing when they might not be able to articulate what's going on, especially with the number of meds that they're on. So be sure to know, hey, what was their starting when they came in? After we did some pretty intense exercise, what was it then? And then at the end, that way you can kind of see what that trajectory is and have an idea of what is really happening underlying versus what you just see. So that's the kind of big differences and similarities I use for personal training and physical therapy from my point of view. I hope this was helpful for you. We've got some awesome courses coming your way. For live, we got September 12th and 13th, we'll be in Milwaukee, Wisconsin. September 26th and 27th, we're going to be in Victoria, Canada. And that same weekend, we'll also be in Anchorage, Alaska. L1 will be starting August 19th, and then L2 will be starting September 16th. We hope to see you at one of these courses. You'll be so ready for Monday and getting after it in the clinic and or in the fitness life, depending on what you are doing. If you have any questions, we will hope to see you on the app, and y'all have a great rest of your day.